Hello there. We're going to go through a procedure, what it's like to be anesthetized for a surgery. I'm a nurse anesthetist, and this is the first place I come in the morning. It's called our pharmacy. Our pharmacist gets most of our anesthesia drugs all set up for us already, so I just need to come in and pick them up, finding out what my procedures are. Then we go out to the front desk to find out what procedures are being done and what operating room we're in. We come out here.
Hi.
Hi. This is the anesthesia board. And we find out where our name and our place is. All right. Don't film my butt. This is called the pre-op area. This is where the patient gets ready for surgery. They come in their street clothes. We give them a pair of pajamas. They lay down in here. We get their vital signs. They get their IV started here. All their history and physical, the chart comes along. The pre-op nurse does all their lab report, what the procedure is going to be done. So what happens when the nurse gets the patient ready, she puts her flag down. The anesthesiologist comes to see them. They put their flag down. The nurse anesthetist, which I am, comes to make sure that they're all ready. Our surgeon comes to make sure that they're ready for the procedure. They make sure their lab is, everything is done, and that their IV is in and their antibiotics are given prophylactically.
Okay, so now from the table, they are taken down this hallway until they were going to be put in the operating room. This is the nurse's station where they all come in the morning. Okay, so this is where the patient would be. They roll on the bed. The big doors would open.
Okay, after they're on the operating table, we get all the monitors on. This is an EKG monitor to monitor their heart very closely. This is a blood pressure cuff. We take the blood pressure cuff every 3 minutes. And then this is a pulse oximeter that we put on their finger. It measures your level of oxygen through an infrared light. And we can see it'll start beeping. I won't put them all on. There we go. So I'm alive and good. There are a lot of medications that are given in anesthesia, and just for today's purposes, we're going to pretend that it's a general anesthetic. So I've already given the patient some sedation. We give a narcotic, and we also give a benzodiazepine. It's like Valium, if any of you have heard of that. Then we actually use these products to put the patient off to sleep. We use a muscle relaxant so we can put the breathing tube in. And these are emergency drugs in case the blood pressure or other things happen during anesthesia. So after they've been pre-oxygenated, we give the drugs to put them off to sleep. And continuously we are watching their blood pressure, their pulse, and watching, and it's monitoring. And we do all our charting through the computer. So everything that is on there comes across, and this is our chart. There are 2 ways that you can keep the patient asleep. This is called an inhalational gas. This keeps the patient asleep, and we turn this on according to their vital signs. Or we can also use an IV anesthetic, and it's a continuous IV medication that runs the whole entire time to keep them asleep. When the surgeon is done with his procedure, he kind of lets me know when it's towards the end. I turn off my anesthetic gas, or I turn off my IV anesthetic, and I wait for the patient to metabolize the drugs, spontaneously breathe, open up their eyes, and they are done with the procedure. We also give pain medicine during the procedure, depending on how painful the procedure may be. So the patient wakes up, I turn everything off, I take off all my monitors, and we proceed into the recovery room. So they get transferred onto that cart that we had brought them in. We use some oxygen to transport them to the recovery room. And in the recovery room, they'll wake up and either they'll go home, or if it's a big procedure, they'll stay the night or two, depending on how serious the procedure was. We are done with the procedure, and now we are walking to the recovery room. And in the recovery room, like I said, is kind of where they wake up a little bit more. The patient comes to here in the recovery room, and again, we hook them up to all our monitors to make sure they're still waking up from their anesthetic. We put on a blood pressure cuff, an EKG, a pulse oximeter. We have a recovery room nurse here waiting for us. We both put on our monitors, make sure that they're stable, and then they slowly awake from their anesthetic depending on what they had. If it was a local anesthetic, they'll probably be out very soon. If it was a general anesthetic, it takes a little bit longer for them to wake up. Or if they had a spinal anesthetic, they wait till they get their feeling back into their limbs or where their procedure was done. And like I said before, either they'll go home or they'll go up to the floor depending on what they had done.